All right, let's talk about meniscus surgery recovery. It's a topic that can be super confusing, maybe even a little frustrating, right? Especially when your recovery timeline seems totally different from what you've heard from other people. We're going to clear all that up today.
So picture this. Your surgeon just told you that you're looking at a recovery of 6 months, maybe even longer. But then you think about your friend or that person at your gym who had meniscus surgery and was back on their feet in like 6 weeks. It makes no sense. You're probably thinking, what is going on here?
Well, the answer, and this is the key to understanding your entire journey, is actually incredibly simple. It's not the same surgery. Yep, that's right. Think of your diagnosis like a fork in the road. And depending on what kind of meniscus tear you have, your surgeon chooses one of two completely different paths. One path is all about removing the damaged tissue, and the other is about repairing it. And trust me, these two paths lead to totally different places when it comes to your recovery time.
Okay, so what are these two paths exactly? On one side, you've got a partial meniscectomy. The easiest way to think about this is like trimming a frayed edge on your jeans. You're just snipping away the little bit that's damaged. But on the other side, you have a meniscus repair. This is more like carefully stitching a tear back together. You're not taking anything out, you're giving the original tissue a chance to heal. And that difference, it's everything.
So let's explore that first path, the removal, also known as a partial meniscectomy. This is the one that leads to that super fast recovery you might have heard about. With a partial meniscectomy, the whole goal isn't really to heal the tissue. It's more of a cleanup job. The surgeon just goes in, trims away those torn, unstable little bits of the meniscus that are causing problems. Once those pieces are gone, the mechanical issue in your knee is pretty much solved. And because you're not sitting around waiting for your body to biologically heal something, the recovery timeline is way, way shorter. We're talking weeks, not months. In fact, the international consensus of experts we're looking at here puts the typical recovery anywhere from 4 to 12 weeks to get back to your activities. Now, the key phrase here is criterion-based recovery. This is awesome because it means you and your physical therapist are in the driver's seat. Your progress isn't tied to a specific date on the calendar. Nope, it's all about hitting specific milestones. Can you get your leg fully straight? Is your quad muscle strong enough? Awesome. You get to move on to the next phase. You dictate the pace. Okay, now for path number 2, the repair. And if this is the path you're on, yep, it's gonna be a longer journey. But it's for a really important reason. You're working to preserve the long-term health of your knee. See, with repair, the surgeon isn't removing anything. They're carefully putting stitches in to hold the torn meniscus together. The goal here is to create the perfect environment so your body can do what it does best, heal its own tissue. And just like a cut on your skin, that healing process, well, it just takes time. And boom, here's where that difference becomes crystal clear. Just look at this timeline. We are not talking about weeks anymore. We're talking about 4 to 9 months. It's a huge shift, and it's all because you have to give that tissue time to mend itself properly. So here's the crucial detail. This recovery is what we call time and criterion-based. What that means is, for the first few weeks or months, biology is completely in charge. You have to follow the calendar, you have to respect the time-based rules on things like bearing weight or bending your knee, all to protect that delicate repair. Only after that mandatory healing window has passed can you start focusing on hitting those milestones we talked about. The expert consensus breaks this down into some really clear phases. First up is the protective phase. Your main job here is just to protect the knee and let it heal. Simple as that. Then you move into the restorative phase, where you start gently getting motion and strength back. And only after all of that, when the healing is really solid, can you finally start the phase of returning to full activity. So let's just pull all of this together. These two very different paths. They aren't just one surgeon's opinion. This is all based on a formal consensus from a whole group of top-tier orthopedic surgeons and physical therapists from all over Europe and the United States. I mean, this table from their report just lays it all out, plain and simple. Partial meniscectomy, it's criterion-based and it takes 4 to 12 weeks. A meniscus repair, it's time and criterion-based and you're looking at 4 to 9 months. They are two different surgeries with two different healing jobs, and so they have two officially recommended very different recovery plans. So if you're the one on that longer path, I really want you to try and reframe how you're looking at this. This is not a setback. It's not a failure. Your surgeon chose to repair your meniscus to give you the absolute best chance of keeping your knee's natural shock absorber for the rest of your life. This extra time, it's an investment.
And hey, don't just take it from me.
This is a direct quote from that international consensus report. The world's leading experts all agree that whenever it's possible, saving the meniscus, even though it means a much longer, tougher recovery, should be the #1 goal. You're on the preferred path. So the question is no longer, why is my recovery taking so long? The real question becomes, okay, now that I get the why, how can I be the best possible partner for my physical therapist and really own this recovery? Understanding this fundamental difference is truly your first and most powerful step.